Today I am going to talk about shoulder joint and its pain. Shoulder joint is a ball and socket type of joint. So it is something like this. So this is kind of ball and this is kind of socket. So this is like a shoulder joint. So movement occur in a shoulder joint is like something like this, which is we call it abduction, extension, flexion and rotation in the shoulder. There are many conditions why patient is suffering from a shoulder pain. In our practice, we normally see 4 most common condition for a shoulder pain. So first one is the labrum tear or the cartilage tear. Labrum is a rubbery soft padding which is situated around the rim of the shoulder joint. Damage to this structure give you the immense pain in the shoulder joint. So labrum tear or cartilage tear, it happens because of the aging process. But now many sports, high sports activity like tennis, basketball, volleyball, softball, where the sports person are using the overhead activity that will damage the cartilage or labrum in the shoulder joint and which gives you the immense pain and the swelling in the shoulder joint. The second condition I am talking about is a rotator cuff tear. So rotator cuff muscles is made from 4 group of muscles. Those muscles hold the shoulder in the place and it helps your shoulder to move in a certain positions. Damage to this structure will give you the inability to move your arm freely overhead or behind your back. Third one, we are talking about the frozen shoulder. Frozen shoulder means abnormal adhesion build up around the shoulder joint and that way your shoulder gets freeze up and you will get lots of pain and you cannot able to move your arm in a certain directions. The fourth one is the impingement syndrome. Impingement syndrome is occur where one of the tendon of the rotator cuff muscles, which is the supraspinatus tendon, which is trapped between the bone of the shoulder joint and which will give you the immense pain and the swelling in the shoulder joint. So now when patient is suffering from any of this condition, they have a pain, swelling around the shoulder joint. Sometimes this pain radiates down to the elbow and to the arm. Patient have an inability to move their arm in a certain directions. Patient cannot lift their arm above overhead. So those are the main conditions patients gets with the weakness in the arm. So now there are 5 most common shoulder exercises which I would like to perform on my patients when they are suffering from a shoulder pain. So first one is the pendulum swings. Let me show you how you do it. So now if you are suffering from the left shoulder pain, you have to bend down towards the land. So and now you have to move your arm in a pendulum like this up to 10 to 15 counts. The second one is you can move your arm this way, now clockwise and anti-clockwise. So in this exercise, basically the gravity is helping you to do the exercise and you don't feel more pressure on a shoulder joint. The second one is the same one, pendulum swings with the weight. So now in this exercise, you bend over, you lean over and you just do up to 10 counts. Move your arm like a pendulum, sideways, clockwise and anti-clockwise. This weight will give you little bit of traction force in the shoulder and if there is an impingement in the shoulder, it will help with the relieving of the pain. Now third one is standing rows. So you take a one TheraBand, stand straight, both your shoulder rotate backwards, your tummy tuck and you pull the bands backward. This is a type of a scapular stabilization exercise. So this you can do for a 10 counts. And another one is elbow lock and elbow straight and you can move straight back. This is again the scapular stabilization exercise. The fourth one is a arm stretch. This is the best exercise when you are suffering from the shoulder, frozen shoulder condition. You have to gently stretch your arm and hold it for 10 seconds. And that gives you some relief in the shoulder pain. And the last one is active assisted range of motion exercise with the wand. So you take a wand, or if you have a broom in your house, you can take something like this. If you are suffering from a left shoulder pain, you have to put this hand like this, other hand like this, and then you can do that. So this is a very good exercise if you have an impingement syndrome or something. If you move your arm externally rotated, it helps and relieves the pain from the shoulder. That's why we are using this arm like in an external rotation and this arm in a normal position. So when you come to Max Rehabilitation Physical Therapy Clinic for your any concerns of pain in the shoulder joint, there are professionals help you and they will show you the right way of doing the exercise.